The Pediatric Liver Transplant Program here at the University of Nebraska has been in place for well over 20 years. The adult liver transplant program started in the mid-'80s and was one of the few original transplant programs after Pittsburgh. The fact that we've been doing pediatric transplants here for so long means that we have a strong history, we have a great team, we have a lot of people with experience. They're still members of our team who are here for the original transplants. And it gives us great tools in terms of having a lot of experience. When parents come and they bring their children here and they've been diagnosed with advanced liver disease, and even to come here to talk about liver transplant can be very overwhelming. We can't change the fact that they have liver disease, we can't change the fact that they probably need a liver transplant, but we can make the whole process easier. And we call it the Nebraska blanket. The blanket is all about making everyone feel as safe as possible. It's an incredibly traumatic time, it's very scary. Even just to come to Omaha, whether or not you're coming from 4 states away, 10 states away, or 20 miles away, it's a big deal to come here. And so we just want to make them feel as comfortable and secure as possible. There's kids that I've known since I was a fellow. When they come back to reunion, I see their parents and I recognize their parents, and the children are growing up, and I have pictures of them in my office. And everyone on our team has children and families with whom they have bonded. If a child needs a liver transplant, it's because of a congenital disease. We need to pay attention to nutrition, we need to pay attention to their growth. We alter their immunosuppression to make sure that they don't get too much medication that would affect their ability to grow and develop. And we also understand that it can be a lot more scary for a child. We also understand that kids really just like to have fun, and they are very resilient. There's crayons and Play-Doh and pictures on the wall, and the windows are painted, and I think we offer an environment where they can actually get through this and they may have some fond memories. We put them through an evaluation where they will meet with many members of the team. We make sure the parents understand the financial implications of the whole process. We talk to them about the potential long-term side effects. We talk about the pros and cons. We educate them about potential complications. The parents ultimately have the decision about what they want to do, but with liver transplantation, we're not doing this unless the child has no other hope for survival. There are two basic options in terms of how they can be transplanted, and one of them is with a cadaveric organ that comes from a brain-dead donor, or the other option is living donation. Especially if they're babies, they don't need a lot of liver, so to remove a part of an adult's liver, usually the left lateral segment is the most common part of the liver of the adult that we'll remove, and that can be placed into the child. What that does is it decreases the waiting time. It gives someone the opportunity to save someone's life, which is an incredible thing. There's very few times in our lives that we can actually do that. The wait time can be 1 day, 1 week, 1 month, 1 year. It's completely unpredictable. We also have to educate them about the fact that sometimes kids get too sick to be transplanted. The operation itself can be anywhere 4 to 8 hours, give or take a little bit either way. A lot of it depends on if they've had previous surgery, previous operations, or there's a lot of scarring or other things like that. We are a moderate-sized program, but we still have a lot of experience in terms of Dr. Langness has been doing pediatric liver transplant probably as long as almost anybody, 20 years, and so he has a lot of experience. So we not only are able to offer liver transplantation to the kids in the region, but we also get referrals from around the country of more complex cases, children with complex vascular issues, and dovetailing on our small bowel transplant program, children with intestinal issues also. From the surgeon's standpoint, it's an incredible thing to ask the parent to trust us. When I look the parent in the eye and I say, well, are you ready to go? They have to say yes, because they know if they don't, their child won't make it. I don't, and none of my partners take that responsibility lightly. It's an incredible honor to be a part of it, and I think the whole team takes this responsibility very seriously.